Medicaid is a lifeline for small towns and rural communities across Virginia. Over 37% of children in rural Virginia rely on Medicaid and FAMUS for essential health coverage, compared to 30% in urban areas. And at least one-third of children in most counties in Southside and far Southwest Virginia are enrolled in Medicaid. Programs like Medicaid ensure that children, pregnant individuals, and families can access preventive care, manage chronic conditions, and receive the necessary mental and maternal health services that they need. Medicaid is a vital ingredient in the payer mix that allows health systems to stay open and to be sources of care, employment, and economic well-being in their communities.
Virginia has made recent strides in improving health equity and increasing access for adults that were previously ineligible for health coverage. But these achievements are at risk if Congress moves forward with cuts to Medicaid. Instead of cutting funding or introducing increased administrative barriers to health coverage, Congress should protect Medicaid, which currently covers over 630,000 non-elderly adults in Virginia through Medicaid expansion. Nearly 19% of non-elderly adults in rural Virginia rely on Medicaid or CHIP for essential health coverage. That's compared to under 14% in urban areas. Protecting Medicaid ensures stability for rural hospitals, providers, and the local economies that depend on them. We need approaches that balance fiscal responsibility while safeguarding the health and well-being of all Virginians.
Congress is proposing massive cuts to Medicaid, threatening funding that supports critical services for children and families and for older adults. The impact of these funding cuts will be most severely felt in rural and small town areas, where more individuals across all age groups are covered by Medicaid. Additionally, in rural and small town areas, severe provider shortages already exist. In Virginia, 31% of counties, all rural, lack adequate maternity care services, creating maternity care deserts. In fact, a bipartisan state work group was formed to address the rural healthcare crisis, and many of their recommendations, including increased use of home visiting programs, doulas, and midwives, depend on access to Medicaid funding. As it relates to seniors, nursing care benefits under Medicare are actually very limited. Medicaid meets that need for Virginia's seniors by providing access to long-term care, both at home and in their communities and in nursing facilities.
Congress must take Medicaid cuts off the table. This isn't just a budget issue. It's about the lives and livelihoods in our communities. Access to affordable and comprehensive health coverage is critical to ensuring more non-elderly adults can work, learn, and ultimately achieve their goals. Reach out to your congressional representatives and let them know to just say no to Medicaid cuts.
The rural healthcare crisis and the growing care needs for baby boomers requires continued access to Medicaid funding. Please call your representatives and senators today to make sure that these cuts to Medicaid do not happen.
There's no way to cut Medicaid without hurting young people and leaving thousands of children and their parents without health coverage. Join us in advocating for policies that protect Medicaid and the families that it serves. Call your congressional representative today and tell them to say no to Medicaid cuts.